Good evening, friends. I'm Dr. Hemavati, working as a professor, and today's interesting topic that what we are going to see is disorders of consciousness. Before going into the topic, the very important thing each individual should understand is whatever we study as or see the symptoms as a deviant from normal behavior, every common person might have this type of behavior. Say, for example, I'm walking on the road. I tend to turn and see somebody call my name. Okay, so it doesn't mean that I'm suffering with auditory hallucination. So sometimes it might happen, but the symptoms does not persist or consistent for a longer period of time. It we react according to the situations, but when a person is affected with mental illness, they don't. So we should understand whatever the symptoms that we study does not mean that we have that particular disorder. Okay, so every behavior, when it crosses the optimal level of an individual, then it becomes a disorder. Hope we have to have a clear understanding whether it is crossing an optimal level or it is beyond that optimal level. Okay, so before going to the topic, I would request people to share, like, and subscribe my channel. Okay, today what topic is disorders of consciousness, we'll see. Okay, now this disorders of consciousness means a person tend to have the confusion. When the person is having confusion, the person will not know where the person is, whom the person is with. All these will have a problem. Okay, not only person becomes confusion, they will not be able to react to the situation, to a stimulus in the environment. So we are going to see what happens in the disorders of consciousness. Okay, this disorders of consciousness has got very important 5 aspects. Okay, number 1, stupor. Number 2, confusion, clouding of consciousness, dream state, and delirium. Okay, each one we'll see in detail. Okay, now I said stupor. When a person is having this disorders of consciousness, having a stupor, the person tend to react in such a way that the person is very mute. Okay, the person will not have any sort of actions, and there will be a rigidity of the muscle tones. Okay, and the person eye movements will be there and respiratory movements will be there, but other motor functions will be not normal. Okay, then you call it as a stupor. The person will not be able to react if, say for example, they might be having a seria flexibility or waxy flexibility in the joints. Okay, so there will be a rigidity in their hands, joints, etc. Okay, so that is seria flexibility or waxy flexibility that you see in the stuporous patient. Okay, right. Coming on to delirium, it is called as acute organic brain syndrome, or acute organic in the sense a person who is having a brain injury tend to become a lack of consciousness, or they might have some sort of auditory hallucinations, and they might have impairment in their memory, so and it affects their consciousness. Okay, so a delirious patient will also have disorders of consciousness. Number 2. Number 3, the person will have a dream state. Dream state, I can give you a typical example. When we are attending the class, our concentration might be for say for example, it might be for 20 to 30 minutes. More than that, we tend to physically present in the class, but we will try to be absent in our mental process. Okay, we will not be able to concentrate more than that, so it becomes a dream state for a person going for a fantasy. Okay, that is what is a dream state, but it is very normal for every individual, so there will be a lack of concentration. Whereas in case of dream state or a fantasy, the person's sustainability or a period of or the duration of dream state will be more than a normal. Okay, it crosses the abnormal level, then it is called as a dream state, where it is going to affect his consciousness. Okay, so dream state, a mind does not stick on to or does not concentrate on an aspect for a period of time as what a normal person will have. Then it is called as a dream state or a fantasy, daydreaming, you can say. So their consciousness gets altered. Third one is dream state, and fourth one is, I told you, it is clouding of consciousness. There is an impairment in perceiving of information, and they will not be able to remember or think, or they can't able to respond. Then it is called as clouding of consciousness. Okay, there will be a lack in the perception in an environment to a particular stimulus. They will not be able to react accordingly, and it affects their consciousness. So there will be a clouding of consciousness. Okay, and the confusion, when a person having confusion, the person will not get oriented to time, place or person. Okay, so these are the very important 5 components that we should understand in the disorders of consciousness. When a person, you are examining a delirious patient or a delirium, a condition called as delirium, then we have to examine whether the consciousness is affected in an individual. Okay, so this is how we should understand what type of a person having this particular disorder. Okay, the other example is, I said, stupor. When we study about catatonia, a type of schizophrenia, in catatonic schizophrenia there is a form, 2 forms. One is excitement, the other one is the stuporous. Okay, so when we see the patients having a stuporous form of catatonic schizophrenia, then we should understand there will be a disorders of consciousness. So when you examine the patient or when you assess the patient, we should understand according to that particular condition what has to be examined. Hope you understood what is disorders of consciousness, under which we have disorders of confusion. Under disorders of consciousness we have confusion, we have dream state, we have delirium, we have clouding of consciousness and confusion. Okay, thank you.